Good morning. My name is Baqui. I'm a physician, co-founder, and CEO at Valhalla Healthcare. We've all seen this, where our doctors' backs are turned away from us, their eyes pasted to the screen, typing away, leaving you, the patient, feeling like you're not being heard, like nobody is listening. But when you do a little deeper digging, you'll find that there's a bit of a more ominous trend that happens. That less patient face time due to over-documentation can actually lead to worsening patient outcomes, workflow inefficiency, and higher costs for the healthcare system. Studies show that nearly half of physician time is actually spent on typing notes, and only a fraction of that time is actually spent directly face-to-face with patients. My team and I, we're on a mission to use artificial intelligence and machine learning technology to deliver the affordable, effective, and accessible healthcare that everyone deserves. And we have a team to back this up. I am a physician who graduated from the largest medical metropolis in the country, the Texas Medical Center. We have a team of lean, mean, and hungry data scientists who already have experience in applying machine learning to healthcare problems. And we have an awesome board of advisors who combined bring over 100 years of healthcare experience to the table. Our solution for over-documentation is Allevia. Allevia is an AI assistant who uses evidence-based means to automate clinical documentation so doctors can spend less time documenting and more time doctoring. We maintain a competitive edge in several ways, one being that we channel over 1,000 studies into the literature to create our data sets. And those said data sets actually become improved over time due to our machine learning models. That means practically that our platform can adapt to you specifically. And finally, and most importantly, is that the consumption of our product happens outside of the exam room. So that means less time being spent on answering history questions in the exam room and more time about figuring out how can we make you feel better. And our early results are promising. We're estimating right now about a 30% decrease in clinical documentation time. That actually translates to about 5 minutes per clinic hour saved for the physician. And finally, patients love our platform. An overwhelming majority prefer our platform over traditional paper intake. And in just 8 months, we've gone from concept to a full working pilot product, with our first pilot just finishing last month. We're actually going to be starting more of our long-term pilots and quantitative studies starting this month. And just as of last week, we've actually just heard that we're going to be starting discussions with our first potential contract that's looking to be closed in around May. When doctors are spending 3 minutes on notes to every 2 minutes taking care of someone, something is very, very wrong. But that's why we're set on this mission. We're here to do something about it, so we can help physicians reclaim the practice, that sacred art that they initially signed up for from the very beginning. And if you're interested in learning a little bit more about what we do or for a private demo, please contact me or message me on the StartupHealth HQ app. With that, my name is Baqui. I'm a physician, co-founder and CEO of Valhalla Healthcare, where we're using an AI assistant to automate clinical documentation so doctors can spend less time documenting and more time doctoring. Thank you.